Morning, everybody. My name is Kwitonda Auguste. I'm a student of immunology. My reg number is 22319 Department of PRS. I'm here to present the immunology. The outline topics we are going to discuss is what what is the immunocytochemistry and how it is performed, how the direct, indirect immunofluorescence antibody tested and how it work, and how the flow cytometer work and used in immunology, the principle behind the agglutination reaction and latex agglutination and how it work in diagnosis. Um, Firstly, the immunocytochemistry is an antibody arranged with fluorescent dyes or enzymes, and they are applied in the sample of cells. When the antibody bind to antigens, there is their activation that allow the antigen to sense under microscopy. This one there is the picture that describe how immunofluorescence works. Firstly, they are direct and indirect. For direct, the immunofluorescent does when it's applied on the sample of cells. Automatically, there is binding with antibodies with antibody. Antibody that immunofluorescent dyes help to be easy to visualize on microscopy. On the other side, there is indirect method where the first antibodies they are not able to form the visible. They require the second antibodies that react with the immunofluorescent dyes. That secondary antibodies increase increase the protein. It increases the ratio of specificity of the antigen antibody that are able to be detected on the dyes. That easy to be detected under the right microscopy. Or on the indirect immunofluorescence and how it tested, they detected the antibodies in the patient serum that used in immunofluorescence microscopy. The steps that followed to do: firstly, the antibody to antigen sample, add an known and labeled antibody to known antigen samples. Means that you know the type of antigen, but you add unknown antibodies. Don't that known antibodies they linked with the immunofluorescent dyes that help to visualize if there is reaction that take place. Secondary is to incubate the mixture of the antigen antibody in the incubation at 37 degrees Celsius that allow the antigen antibody to have the optimum temperature as the body has the temperature at 37. When you put at room temperature, example on the temperature of 24 on 32, there are some antibodies that are not allowed to react on that condition. On the SAT7 antibody, on the SAT7, they allow all antibodies and antigen reaction to take place due to its optimum temperature that the body work in normal ways. So, third is washing to remove the unlabeled antigens. The unbonded antigens are washed out and they remain with the antigen that linked with antibodies. There, there is other for addition of fluorescently adding the dyes with labeled antibodies. This second dye such as antihuman globulin used it to conjugate with the fluorogens. These immunoglobulins help detect to detect that antibodies that are failed to link with antigens in because of small size their small size, their low immunogenic, the low immunospecificity that immunoglobulins help that antigens antibody to react. This lastly is to examine the that sample that on the slide that if there is the antigen antibody the reaction on the fluorescent dye on the fluorescent microscopy under the ultraviolet light there is uh, there is a reaction that show you there is a reaction that take place on antigen and antibody. This is a figure that explains that. Firstly, there is an antibody, the antigen on the slide, uh, on in the plasma, there is an antibody, or in the serum, there is antibody that are IgG or IgM, and IgM is present in is the primary antibody that formed when there is an infection or there is an interest of antigen in the body. The first, they form the IgM, and the secondary add fluorescent labeled with antihuman globulin or and other immunofluorescent that have the dyes that are easy to be visible under the ultraviolet light. The this is the primary antibodies that not need to be conjugated with chromogens because chromogens they help to operate to easy to visualize under microscope. The second the second one is that are used to conjugate with chromophore immunochromes that to give color in the light microscopy. The first antibody it help to increase sensitivity of the staining. The use of the immunofluorescent is used to diagnose the disease using the in the laboratory example to observe the presence of trypanemia pardon antibodies in the serum. This is effectively used for easy to see if there is present. Therefore, the other topic which is flow cytometer. Firstly, flow cytometer is technique used to analyze the how cells are differentiated. is technique used to sort out of the cell based on their physical and chemical characteristics using immunological study of cell sample. How it work? The flow cytometer are used to separate uh, cells depend on the volume, and size, and what inclusive in the cytosol. Example, if is a granulocyte, they distinguished from a granulocyte. This is performed by the suspected fluid in the stream and passed through the laser beams scattered to emitting light to detect sensors and computers to analyze data. That computer show or screen show how the cells are differentiated according those characteristics such as physical and chemical. How they used to phenotyping cells used in the cell activation function and analyze cell proliferation, how cells are or when how cells are growing up from the progenitors to the precursors to up to how it's giving the mature cells, and used to study the immune disorders, and used to develop and monitoring vaccines. This is a diagram that shows how the flow cytometer work. There is how the area for of sample, and that samples are mixed with sheet fluid or fluid that help them to make suspensions. Those suspensions that this allow the reduction of concentration of the cells in the flow cytometer. And other there is the laser or the laser light source or laser beam that light are passed to the cell, and the light that are passed in the cell, they are the light that scattered in the cell, and that emitted the cell. The fluorescent emit from the staining cell detected and forward and side scattered light in the cell are detected. All light are detected. Those of scattered, those of emitted, and those of reflected are detected. The amount of that light are used to identify the cell type, physiological component, and chemical components such as granule or agranule, nucleated or unnucleated isoform. There is other topic to discuss the principle of agglutination reaction. The agglutination reaction occur when there is antigen antibody react. That reaction, if there is a reaction show there is a compact solid or rhesus of the cells of the antibody show there is a reaction that takes place. When there is the presence of the antibody, the in the cell, and if mixed with the antigen in the cell antigen, they make responsible antibody are mixed. um, antibody bind to antigen specifically and cause the clamp together. They make uh, structure form like clamping or like solid form that are easy to be visualized with naked eyes. This is a figure that describe it. Also, there is indirect agglutination reaction and direct agglutination reaction. When it is direct, when they will take antibody and antigen directly, they show there is a reaction, there is a clamp that formed. If there is indirect, it requires the antigen to be helper to make reaction with the antibody. The antigen only they are not able to make a complex with antibody if the antigens are lose the supportive molecules. That supportive molecules help the antigens to be easy to bind with the specific antibodies, to be easy visualized, to be easy to make reaction and easy to make clamp with helper of some molecules that are proteins or other chemicals that assist that increase the rate of reaction or compact that antigen together to be easy um, to form a reaction. They are uses of antigen antibody. The uses for agglutination in the body. They they form the protection in, in the protection and it help in basis of the antibody mediated immunity. In vitro or in the laboratory, it helps to assay can to detect the presence of either antigen or antibodies in the sample and help to monitor the level of immune response and they identify molecular of biological and medical interesting. Like example, and identification of medical interesting such as identifying the presence of toxicity that are present in the medical solutions, right? Like in the drugs that they help to monitor the standardization of the medicine or drug that are used. If there is no any substances that are harmed from that can harm the patients if the is administered. That is the factors that affect the agglutination reaction, their temperature, there is antigen antibody ratio. If there is more antigen than two antibody, there is polysomes where you can make the false negative results and their reaction environment like pH and the protein concentrations of environment. The latex, they also discuss on the latex agglutination. The latex agglutination is the test that can take by correcting sample containing specific antigen or antibody which are later mixed with antibodies or antigen. The you can mix antibody to antibody or can mix antigen to antigens. and when they release, there is they make latex hybrid that can clamp together. This clamping correct agglutination. This is how dance. They suspended the latex particles coated with specific antibodies, and there is anurite. Anurite can be antibodies or antigens. Then, if there is presence of the anurite, there is an antigen that cause cross link and make agglutination. The the latex agglutination, they are used to monitor the acute infection as monocrosis and acute bacterial meningitis. That meningitis are used to identify bacterial antigen that involve in the CCF cerebrospinal fluids and help to investigate the foodborne pathogens that can cause the enterotoxicity in the food by spoiling our foodborne organisms. Thank you for thank you for your listening this presentation. We meet on the next section. Thanks.